Thank you for tuning into Naijha Speaks. My name is Naijha Wright-Brown, co-owner of the Land of Kush Vegan Soul Bistro in Baltimore, executive director of the Black Vegetarian Society of Maryland, and contributor for Jane Unchained News. Today's guest is a plant-based doctor who is on a mission to get people empowered to learn the truth about food, prevention, and Black health from top Black plant-based health experts. She is going to tell us all about what's going on at the Reclaim Your Health Summit this week. But before we do that, let's watch this clip.
Hi, I am Dr. Judy Brangman, an internal medicine physician who is on a mission to help others live healthier and to thrive. Listen, I know that this year has been challenging in more ways than one. We are not only battling a pandemic that has led to the death of more than 750,000 people worldwide, but a pandemic that has also been overshadowed with conflicting information and misinformation from different sources, to the point that you may even feel that you do not know who you can trust. Added to that, you may be dealing with unique financial constraints that the pandemic has presented, including learning how to homeschool your children for the first time, or navigating distance learning. As if that wasn't enough, the recent racial tensions that have surfaced have left some feeling vulnerable and hopeless. This is why I created the Reclaim Your Health Summit. We know that racism and healthcare disparities exist, and COVID-19 has proven to be no different. African Americans have been disproportionately affected. In the majority of states reporting data, Black people accounted for a higher proportion of cases and deaths compared to their share of the total population. Studies have shown that chronic disease increases the risk of complications from COVID-19. But what you may not know is that it is estimated that 80% of chronic diseases, stroke, hypertension, heart disease, and type 2 diabetes, could be prevented with diet and lifestyle changes. Your genetics is not your destiny. The Reclaim Your Health Summit is a free online event designed to empower you, educate you, and inspire you so that you can thrive and live well during the pandemic and beyond. It will teach you what foods you can eat to empower you to live healthier and achieve optimum health. It will also teach you what foods you should avoid to maintain optimal health. I know that there's so much conflicting information out there about nutrition and wellness and prevention. And sometimes the food that we have been led to believe is healthy for us actually is harming us. So in this summit, I have brought together 21 experienced plant-based health experts who are also dedicated to improving the health of minority communities. We know and understand the unique healthcare concerns that people of color have, and we also know and understand the unique social constructs that people of color endure around the world in just about every country. You do not want to miss this. We were created to thrive and live well and to live a vibrant life full of purpose and vitality. But sometimes our environment, social constructs, and other things can get in the way of us living our best life. So take advantage of this one-of-a-lifetime opportunity to reclaim your health. You do not want to miss it. I look forward to seeing you in the summit.
Thank you. I can't hear you. I think you're muted. I think your sound is muted.
Oh, I'm sorry about that. Without further ado, introducing Dr. Judy Brangman. How are you doing today? Thank you for taking the time to joining us. Yes. Dr. Judy, tell us a little bit about yourself and your plant-based
so I've been
journey.
plant-based for about 6 years now. I'm a board-certified internal medicine physician based out of Raleigh, North Carolina. I have my own business, Newell Health, where I coach and counsel patients, clients on how to live healthier, how to adopt a more plant-forward diet. I also work in a hospital setting. And so the summit really was just an opportunity to take advantage of the online space, which has really blown up since COVID-19, and present something that I felt was a need in the Black community.
Awesome, awesome. And it's definitely, yes, like you said, it is very much needed, especially in this time of COVID and everyone going through this pandemic. Talk to me about how you define plant-based versus vegan. So you're plant-based or vegan?
I'm plant-based. So vegan
Okay.
is an ethical stance whereby you are choosing to not consume, eat, or use anything that involves any part of the animal and any part of the production of that good, as well as, you know, the final product of it. And whereas plant-based more is a health-conscious stance. So that is how I came to the plant-based world. Now, once I came in the plant-based world, I started to learn more about the effect on the environment and become concerned about animal cruelty and how animals are housed and treated on these factory farms. So that was like a secondary motive for me to go plant-based. So I find that with the mass public, the general public, using the term plant forward is more user friendly, because the big issue is that most people aren't eating enough fruits and vegetables, period. It's not a matter of making everyone in the world stop eating all meat and dairy right away, because not everyone is interested in doing that. And so you have to meet people where they are. So that's the specific population that I aim to reach. Those people that are resistant to plant-based diets, those people that are meat lovers, I guess, so to speak, really trying to convince them that they need to eat more vegetables is my goal.
Awesome, awesome. Were there any books or documentaries that inspired you?
No, there wasn't belts. It was actually someone that I knew. I knew someone that was vegan, and they were telling me about the health benefits of it. And also, my mother inspired me to really go fully to cut out dairy. We grew up. I'm from Bermuda, so I grew up there, and it's a plant predominant diet for the most part. We grew up mostly vegetarian. We didn't eat pork or red meat. If we ate meat, it was a few times a week. So we never really ate a lot of animal products. And so it's always been something that I've always known lots of people that were vegetarian or vegan. And so it wasn't a new concept for me. But of course, giving up dairy did seem intimidating at first and like it was a challenge. And most people do say that. But once I gave up dairy, I will never look back, because you feel so much better not eating those foods that our bodies were not designed to eat. And so once you adopt a plant-based diet, you later on will likely become aware of the environment and the animal cruelty issues. But a lot of people are not there to even think about that, because they're not even taking good care of their own body. So they can't even think about, okay, what about the animals? What about the environment? You know, a lot of people are under so much stress, especially underserved populations. They're just trying to make it through to the end of the day. They can't even fathom that life really could be better.
Right, just trying to survive everyday challenges and obstacles that are being constantly thrown their way, especially in the African American community, people of color in general. But I want to thank your mom for getting you off the dairy, and definitely you mentioning that this is not a new concept. People think that this people of color eating vegan, plant-based, this is all new, but no, we've been doing it. You had the Rastafarians, you had the Israelites, tons of folks of people of color that have been living this lifestyle. What type of challenges or opportunities do you face advocating for the plant-based lifestyle in your community and amongst peers who are not plant-based?
So I think amongst the general public, my patients and clients, people tend to have mindset blocks about plant-based diet. They think that it's difficult. They think that it's expensive. None of these things are true, mind you. And then people of color sometimes think that it's not for Black people, quote unquote. They think it's a white thing, which that's that's one thing that's touched on a lot in the summit regarding the diet that our ancestors ate in the continent of Africa. It was heavy on vegetables, is heavy on vegetables and starches. They did eat meat, but it wasn't consuming a large portion of the diet like it is here. And certainly processed foods, which are another issue just as bad as meat and dairy, isn't a large part of their diet. So when the slaves had food to eat, it was the scraps that the slave owners gave them. And so to make the best of it, they seasoned it, they fried it to try to make it palatable. And so they did the best with what they had. But those foods, in essence, are really leading to our demise and are killing us, quite frankly.
Yes, I agree. And it's I'm glad you mentioned it because it's just reconfirming. I had a couple of other guests on previously, the Brooklyn Borough president, Eric Adams, who has a book out, Healthy at Last, where he talks about all that. And then Dr. Nolan, who has a book out, Hip Hop Vegan, and he talks about that. So, we're encouraging people to definitely educate themselves because, again, it was slave food, but we have arrived and we don't need to eat this way. We need to eat more healthier. How detrimental was the issue of chronic disease in the U.S. before COVID-19, and how detrimental is it now?
Well, chronic diseases have always been a serious issue. Obesity is on the rise, and a lot of conditions are related to obesity. So type 2 diabetes is related to obesity, as well as heart disease. And with people eating more processed foods, going for quick options, we're seeing more obesity, and that is a risk factor for a lot of different conditions. And this is particularly important in the minority communities because oftentimes we're dealing with social stress. And talk that went up yesterday, Dr. Columbus Baptiste in the summit, he talks about racial stress and how we talk about stress, right? Like you have an argument with somebody or maybe in a bad relationship, you talk about that stress. Everybody knows about that. But there's also racial stress from the constant having to always prove yourself, so to speak, or being aware that you may be judged unfairly, or even this, not being able to feel like you can trust the police. That's what we call racial stress and what he talks about. So that contributes and affects our health as well. And so you have the statistics that show African Americans are twice as likely to die from heart disease compared to white non-Hispanics. They're also more likely to get colon cancer earlier as well as die from it. That's why the recommendations for colon cancer screening for African Americans start 5 years earlier. It may be different now, maybe 4 to 5 for everybody, but I know it was 5 years earlier for African Americans. And so on top of that, we also have the distrust of the healthcare system. So due to the history in this country and things that have been done in the healthcare system, a lot of people don't like going to the doctor and they don't like taking medications. And so when you look at the research and the evidence and how plant-based diets have been shown to reverse type 2 diabetes, prevent heart disease, which heart disease is the #1 cause of death in the US. I feel like plant-based diets is a tool that's underutilized, but it can give African Americans some power, and it can also give them something that you cannot find anywhere else. The chance to be healthier, the chance to potentially take less medications or maybe no medications, I think is empowering.
Awesome. I'm so glad that you mentioned that. Well, we're here to talk about the summit. We're here to talk about reclaiming your health, the Reclaiming Your Health Summit. What is going on? It started on the 14th. What's been happening?
So it started on Monday, and I'm so excited how it all came together. Literally, it was the end of June when I reached out to just connect with the group of Black vegan doctors that I had been connecting with. I was like, hey, let's, connect, introduce yourself, because I felt that there was not that many of us. And when you go to the conferences and summits, I just don't see brown people being represented, period. So I just was connecting just to network. And then I was like, you know what, we should do something like maybe have a webinar or a summit or do something. And everybody seemed like they were interested. And everybody was like, oh, it's so nice to meet other Black doctors, because most of them didn't know each other. And I've never met any of them in person, except like 2 of them, actually.
Wow.
And so then I don't remember whose death it was, which Black person it was. But it was then when I was like, you know what, I need to do this and I need to do it now. And I wanted to do it before school went back in because I knew people would be distracted. And so I really, really pushed to get it done. Literally, I think 2 months, 2.5 months, which for a project of that size is a really, really short period of time. So I just praise God that it all came together. I was able to find the team members to put it together, and the feedback has been phenomenal. People are calling me, messaging me, Facebooking, saying how much they are learning, how great it is, and how they're so glad to see something like this that's geared for the Black community. Because I've done tons of summits. I go to all of the plant-based conferences, and the food that they cook is different. The focus is slightly different. Whereas every conversation that I'm having with these doctors and healthcare experts, we're all mindful of the different challenges and concerns that the Black community has, so access. And we talk about how, people sometimes think that vegan diets is not for them. So we talk about that. We talk about soul food. We talk about how we don't like going to the doctor and, different things that we can relate to. Even on I think it's day 5, one of the speakers, Dr. Barnes, is a family medicine physician, and she talks about movement and exercise. And she teaches and does African dance. So she actually does an African dance segment in her presentation, which where else are you going to see that? So I'm just really excited to put together something that can help people, because we really need to improve our health so that we can, do what it is that we are meant to do on this earth.
Right. Our health is our wealth. You can be as rich as you want to be, but without your health, you're not really doing anything. And, I got my VIP pass, so I purchased that so I can watch the replay and everything. So I'm excited about it. It's like you said, it's one of its kind. You don't see anything like that. And to know that there's that many plant-based doctors out there where you can gain and learn all about health and get your questions answered. Folks, reclaimyourhealthsummit.com. Make sure if you haven't signed up that you sign up, because it is free, right? There's no cost to this. It is a free summit, and now is the time to take advantage of this, because we have no idea where we'll be this time next year, but wherever you're going to be, you want to be healthy.
Right.
How do nutrition and integrative medicine play into alleviating mental health? Because, we talk about health and we talk about, your internal system and the physical fitness, but mentally, how does that play into alleviating one's mental health?
Well, mental health is very complex. It's not necessarily possible to alleviate. Some people just have genetic, and they just have depression, anxiety, or bipolar. And no matter what they do health related, they're still going to have it. But mental health is important. Diet is important, as well as exercise. So sunlight and fresh air have been shown to improve the mood, make you feel better, more upbeat and whatnot. And then also exercise, that has been shown in studies. So yoga, mindfulness, meditation, all of these things have been shown to be helpful in improving anxiety, so to speak. Which is really important right now, because everyone probably is feeling some sort of anxiety or uncertainty about the events that are happening in this year. And so it's extra important to make sure that we are aware of our internal voice, the voices that we have that, affect our thoughts, so to speak.
Yes.
Be mindful of that and make sure that we're moving and getting outside every day if you can. Sit on the porch, go for a walk in the sunlight. It's really, really helpful. But also there's a lot of shame too around and stigma around mental illness. There's no reason to be shameful of that. So if you're having trouble coping, you need to talk to your primary care doctor about that, because there are medications that can help.
Yeah, I had a bout with anxiety when I turned 30, so my early 30s, and I used to get these reactions in my hand, like it would go numb. It would feel like I'm having a heart attack, so it was kind of like a panic attack thing. And I would go into the clinic. We had a clinic in our building, and they would just say, it's all in your mind. And this was about the time, I think, when the anthrax was out. Remember that whole big anthrax scare, so everything was like, paranoia. But I learned to meditate more, listen to meditative audio tapes, and to calm me down. So exactly, you shouldn't be ashamed of that. You got to get what you need to help you work through that. Are there any particular foods that you would recommend? that people?
So there's not strong data on foods per se and mental health to my knowledge, but I know that berries are good for memory. Fruit, can help you to feel a little bit better. I use fruit instead of using candy and sweets and junk food. And you want to avoid sugar.
Right.
Sugar really is not helpful. It kind of can give you like a high, so to speak. But then once the sugar is, digested, you kind of like at a low again. So if you're dealing with anxiety, alcohol and sugar, added sugars are things that you want to stay away from. And just stick with more fruits, fresh fruits, raw fruits, and some vegetables too.
Thank you for that. So do you think plant-based lifestyle is the way to go?
Yes, for sure. Even for anybody, it's for anybody. It's not something that only rich people can do. It's actually not that expensive to be plant-based. If you buy beans, raw beans, canned beans, it's like $1 or $2. And then vegetables, you can go to Aldi, Walmart. So it's definitely for everyone. And I like to make it attainable and something that seems like anyone can do it, because I think the nutrition space gets crowded with a lot of noise and people making it seem way more complicated than it needs to be. So I like to break it down into simple terms. The basics is that at least half the food on your plate needs to be fruit and vegetables, really mostly fruit, and eat the rainbow. So look at your plate and you should have different colors of vegetables on it. That's the foundation of being healthy right there. And then we can add the other things on it, right? Like cutting out the meat, cutting out the processed meat, cutting out the red meat, and then cutting out the dairy. So it's like steps to it, but you have to think of it as a journey.
Right. Awesome. Awesome. This is great information, everyone. So Dr. Judy Brangman, I mean, this is a lot. I just wanted to share your information. Internal medicine physician, lifestyle medicine consultant. Her website is theplantbasedmd.com, and she's the CEO owner of Newell Health. You can follow the Plant-Based MD on Facebook and Instagram at the Plant-Based MD. And there's also a YouTube channel. Everything is in the comments, so you can easily click on those links. But I just want to let everybody know all that information is there to follow Dr. Judy and the Plant-Based MD social media pages. I just want to take this time out to tell everyone to like and subscribe to NaijhaSpeaks.com and give a shout out to my sponsors, The Welfare World, Veg Fund, Women Funders and Animal Rights, and Eat the Chain and Jane Unchained News. Again, sign up for the free Reclaim Your Health Summit today. You can do this today. I mean, we're only on the third day, and they're running it through the 20th, and you can get the VIP package to watch the replays for life, right? That's for life. You'll have access to that for life.
They'll be able to download it to their computer.
Oh, and you can download it. Okay, great. So you'll be able to download them. So I think it's definitely worth it, whether you're going to watch it for free or if you're going to spend a little money just to download the conference, the summit presentations onto your PC.
Now, if they sign up, I was going to say, if they sign up today, they're going to get the videos starting from tomorrow.
Okay, so if you sign up today, you'll get the video starting from tomorrow. Still a decent deal. Still a decent deal because you can rewatch them up to 48 hours, I think.
Yeah, it's pre-recorded and the email goes out at noon every day with the link for that day.
Awesome. Is how can vegan and or plant-based advocates effectively disseminate this much needed info into our communities? What are some best strategies that you can think of? So we take something like a Reclaim Your Health something or something else that's going on. How is the best way to get this information out?
And there's so many different ways. It could be through social media. I leverage social media a lot. And it could be working in your own community, starting where you are in your own household. Because some people have family members that are not eating healthy, and they probably want them to make a lifestyle change. So I would say it starts in your own house with maybe baby steps. And if you have someone that's not plant-based that you want them to be, just start with a meatless Monday, or say, do a challenge where we're going to be vegan every Monday or something like that, but starting small, making it specific, measurable, and something that's achievable is going to be easier rather than saying, okay, I need to get my whole neighborhood to be vegan right now.
Right, right. Awesome, awesome, awesome. Before we sign off, what tip or piece of advice would you like to leave the viewers with?
I would say one tip would be to eat more plants, really. Just
It is that simple. Eat more plants.
eat
It
more
can't get
plants.
any easier than that. Just eat more plants.
Yeah, that's it.
Is
However you want to swing it. You don't have to be fully vegan if that's not what you're ready to do yet, but wherever you are, start somewhere.
again, Dr. Judy, I appreciate you taking this time out to speak to us about the Reclaim Your Health Summit. So, everyone, please, please, please sign up for this free summit now. Just simple, reclaimyourhealthsummit.com. Register, it's free. Get a loved one involved because someone you know and love needs this information. And, we don't want to pass it up. This is a great opportunity. We don't have any questions. We have a lot of highs and thank yous.
Okay, good.
So I think that's pretty much it for today.
Yeah, I was gonna say, I've never seen a summit with all Black people like this in health, a health summit, and all of
right.
the people that are, I guess the more well-known people in the vegan space that are people of color. All of them are in the summit, plus others. So there's new people that people may not have seen, but they all did such a really good job at, presenting the information. And so it definitely is something that you want to sign up for, tell your family members. My mom is in Bermuda, and actually there was a hurricane there on Monday, so she couldn't watch Mondays. They were without power. She didn't get power yesterday, and Monday was her birthday, and she was
Oh, wow. Happy birthday, Mom. Happy belated birthday.
Helping me she was reviewing everything. I ran everything by her because she's done a ton of summits. So it's just a matter of getting the word out, word of mouth.
It's happening. It's happening here.
But
And
thank
I'm
you for the opportunity to be on today.
Oh, no, Rob. Thank you for taking the time out because I know you're busy and trying to managing the conference, even if it is pre-recorded, it's still a lot involved. Make sure everything is working well and answering and addressing questions. So until we connect again, stay healthy. I know you will because you'll be eating those plants.
Oh, I like your shirt. Your shirt says plants.
Plant
pusher. Ooh, I like that.
Yes. This is like a big movement. The plant pusher.
That's cool.
Yeah, absolutely, really, really cool. But we're gonna connect some more, Dr. Judy. So take it easy
so much,
everyone. Be healthy and mask on.
Yes.
All right. Have a good one.
All right. Thank you, Naijha. Bye, everyone. Bye.